Right, we're going to go ahead and get started. Good afternoon, everyone. Welcome to our last Recovery Summit presentation for this year, which is a panel discussion on treatment and prevention of substance use disorders in St. Clair County. This webinar is part of a series hosted annually by St. Clair County Community Mental Health during the month of September, which is National Recovery Month. Please feel free to use the chat box for all questions or comments. Our presenters will be answering questions as time allows. Continuing education credits are offered for today's presentation. If you are requesting professional credits, you must remain on the webinar the entire time and complete the survey at the end of the presentation to receive credit. And now I would like to turn it over to our CEO, Deb Johnson.
Thank you, Christy, and welcome everybody to the final presentation of the Recovery Summit for 2024. There have been a number of really great webinars throughout the month, and I know that we've had really good attendance at most of them, and so for that, we're happy. We really appreciate the opportunity to continue to educate our community about substance use disorders, the treatment that's available, and trends and other important things that you need to know. And of course, we also always want to share the recovery stories because I think that's what gives people hope that there is a brighter future. So we'll start off by having each of our guest panelists. Well, I'm going to actually, I'll go one at a time. You can introduce yourselves, and then I'm going to ask you to give a little background about your organization and the work that you do with individuals, or what you do is related to people with substance use disorders. And for this, we will start with Jim Johnson.
Good afternoon, I'm Jim Johnson. I work for the Region 10 Prepaid Inpatient Health Plan, also known as a PIHP. We are a governmental insurance company of sorts. What we do on behalf of this, we contract with the state of Michigan to fund and monitor public mental health and substance use disorder services across Genesee, Sanilac, Lapeer, and St. Clair counties. Although we're not a provider of services, we do provide access to a full array of services to treat substance use disorders, including traditional outpatient services, intensive outpatient services, community detox services, residential services. We also have peer support services and are involved in helping provide access to medication-assisted recovery across the 4 counties, including the use of methadone. And that's it. You're muted.
Sorry. Next, we'll go to Liz King.
Hi, everyone. I'm Liz King. I'm the Health Officer and Director here at St. Clair County Health Department. And our role primarily is centered around, as public health professionals, centered around harm reduction and bringing emphasis of the science data analysis to the conversation. We also, consider ourselves conveners of the community a lot on different projects. Like the Community Health Improvement Plan or Community Health Needs Assessment, and just being present for the conversations.
Okay, why don't we go to Ken next?
So my name is Ken Huvelman. This is a loaded question for myself. My primary position would be as a substance use disorder family support program supervisor with Professional Counseling Center. What we do is go and provide in-home clinical drug and alcohol services for families that are involved with CPS or foster care. And that's across St. Clair County and then the 5 counties of the Thumb region. Additionally, I contract with Port Huron Odyssey House to help with their mobile overdose response team, or MORT, which is a program that engages law enforcement in Yale, St. Clair, Marysville, and then here in Port Huron for post-overdose interventions for individuals that recently experienced an overdose. Another role that I take is I work with the Community Services Coordinating Body's Substance Use Prevention, Treatment, and Recovery Work Group as the chair of that. That's a collective of treatment providers and other organizations that have really our stakeholders in the substance use disorder world in any of those realms with prevention, treatment, or recovery. And then also I work with St. Clair County for our opioid advisory subcommittee, focused on creating in-county treatment options and advising on ways to utilize some of the opiate settlement money that is coming into our community. So those would be some of the things I do. And then, in my spare time, everything else.
And a pretty avid runner too, right?
Yeah, if there's a recovery, shucks, I let Sheriff King beat me at the recent one at the Strides for Recovery, but then also participate in the Run for Recovery with CMH.
And a lot of other ones. All right, let's go to last but not least, Sheriff Matt King.
Well, hi, I'm Sheriff Matt King. I was going to start out by saying what I usually do is go to 5Ks and lose to Ken, but he stole my thunder there. I am the sheriff here in St. Clair County, and we have our drug task force and other parts in our law enforcement to interact with people who are suffering from substance use disorder. But we also participate in many other programs. Several of the boards that Ken just spoke of, I sit on as well. And we are constantly trying to learn how we can be part of the solution to problems in our community. And obviously, substance use disorder is one of them. And another big part of what we do here at the sheriff's office that oftentimes isn't thought about is our jail and all of our programming in the jail to help set up inmates and detainees so that when they leave, hopefully they have the skills and at least some new skills and ways to reach out so they don't relapse if they are somebody suffering from substance use disorder or who is impacted otherwise from their home with people who are suffering from this disorder. So as law enforcement, we're oftentimes the first responders, even before EMS and fire, because we have to make scenes safe. And we continuously learn how we can impact these calls for service and the community as a whole as a positive interaction outside of our law enforcement responsibilities.
Thank you, Matt. All right, and I'm just going to throw in there. I mean, I am the CEO of St. Clair County Community Mental Health, and we do have a lot of substance use disorder services as well, including medication-assisted treatment. Jim was referencing that. We have individual therapy. We have certified recovery coaches. We have a lot of groups as well, and of course, we always have crisis support services through our mobile crisis unit for anybody in crisis for any reason. But I think it's just important to continue to remind the community that prior to 2019, we were not able to provide just substance use services. A person had to have a dual diagnosis, meaning mental illness and substance use. But since we became what's called the CCBHC, and that's a topic for another day, Certified Community Behavioral Health Clinic, we are able to serve anybody with a substance use disorder, whether you have insurance, private insurance, Medicaid, no insurance, can't afford your co-pays, we can help out. So give us a call when you need us. And also you can find out more about all of our services on our website or Facebook, or we have a great little snappy brochure about it, and we're happy to pass those out. So let's go to the next question. And I think I messed my order up on the first one because I was going to have each of you go first, but I know Matt won't care if I defer to Jim one more time and let him describe the current substance use trends in St. Clair County and how they have evolved over the last few years. And then I'm going to go to Matt second. Go ahead, Jim.
Okay, thank you. I want to make sure everybody knows that what the data that I have is admissions data. So when I talk about prevalence of certain conditions in the community, I'm really only talking about the conditions that come to our attention. So when you hear us talk about that, you may hear the sheriff and I have differing data because we don't always see the same people, although I'm sure we see a lot of the same people. So over the course of fiscal year 23, we had over 1,360 admissions of St. Clair County residents into SUD treatment. Those admissions are about 60% or more men. And that is something that's been trending up over the last several years. It used to be in the low to mid 50% men and 40-some% women, but the incidence of men engaging in treatment seems to be increasing over the last several years. Almost half of the admissions we have are for people between the ages of 26 and 39. That's always been, or for many, many years, has been our largest population group. It has actually gone down a little bit as we've seen an increase in the admissions of folks between the ages of 40 and 49. So on the plus side, that may mean we're doing better at engaging people and keeping them in treatment. It's just those same people getting older. On the downside, it may just mean that trends have shifted and we're seeing different people. But that population has seen an increase. And it is our second largest age group of folks that we're likely to see come to us. One of the shifts that we've seen over the last couple of years is we used to see almost half of our people entering the system through outpatient treatment. And that's not the case anymore. In fiscal year 23, about a third of our people entered the system heading to a traditional outpatient appointment. And last year, about 27% of the people actually started their recovery journey at detox. So that number has gone up, which may mean that that people aren't getting into treatment as soon as they used to. And it may just be related to the types of drugs that folks are using now, that they need to start at detox and move from there. And about a quarter of the people that we see start in a residential placement. In terms of substances that we're most likely to see folks requesting treatment for, alcohol remains the number one substance of choice for folks who get public SUD services. About 45% of the folks that we admitted last year provided alcohol as their drug of choice or primary drug of choice at the point of admission. It's a slight increase. We had about 17% of our St. Clair County admissions that identified heroin as their substance of choice, and that's a fairly significant decrease over the past several years. A lot of the work that's been going on to address the opioid epidemic, at least from the standpoint of admissions to treatment, seems to be making an impact. So 17% is significantly down. And then the substance that is significantly up, that will come as no surprise to our sheriff, is methamphetamine. We saw in the past year about 17% of the folks who entered treatment from St. Clair County were reporting methamphetamine use as their primary drug. In years past, St. Clair County was always a little higher than the other counties in our region in terms of percentage for methamphetamine use, but it used to be around 6% or 7%, and it has grown significantly as the heroin admissions have gone down. Most of the folks we see have never been married. So if you want a picture of who's getting into public treatment, about 60% of the folks that we see have never been married. About 6% of them have dependent children. And about 3% of the women that we admit into treatment in St. Clair County are pregnant at the time of admission. We seem to have a higher than would be expected representation of Black or African American folks admitted into treatment. About 13% of the folks that we admitted last year identified Black or African American, compared to about 85% white and the other 2% other ethnicities. And so the St. Clair County, the last census information I saw, was about 94% white and about 2% Black African American. So we do seem to be getting a high, relatively high percentage of folks, Black and African American heritage into treatment. And about 80% of the folks that we see in treatment are either unemployed or not in the workforce. So that's kind of what we see coming through the Access Center and into our treatment community.
Thank you, Jim. That was a lot of data. How does that stack up with what you're seeing, Matt?
None of it's really surprising. I could say that one of the things that we've seen over the last probably 5 years is our inmate population has grown as far as our female inmate population. And I believe that is because of substance use and the crimes that are wrapped around obtaining the substance individuals use, to the point where our female pod is almost full all the time. And it used to be that we had a lot of extra room in our female pod. So that's one trend that maybe contradicts a little bit with what Jim was saying, but everything else is spot on. The heroin problem is still out there. We still see them, the drugs on the streets in our drug raids and concentrating in our investigations, but nowhere near what we did a decade ago or even 7 or 8 years ago. And I think that's because we knew exactly, for the most part, how that addiction was getting out there and growing, right? People who were never intending on becoming addicted to a drug, just taking a drug that was prescribed to them, becoming addicted. So we had a target on how to stop the growth of this addiction problem in our community. The methamphetamine is a whole different drug. It's a different type of drug, as it's a stimulant, not a depressant and a hallucinogen as opioids are. That means that people are usually, well, not usually, I would say always taking this drug with the intent of using it for an illicit purpose, because obviously it's not prescribed. It's very addictive, and we've seen that drug just blow up in our community. And it is the largest drug problem in our community. The other thing that we see, and I know it's the shock to people on the panel, probably a lot of people listening, is synthetic opioids. May it be fentanyl, carfentanil, or some of these other ones, they're being cut into different drugs. So we're seeing fentanyl and methamphetamine quite often. People think they're buying methamphetamine and they're seeing a little bit of fentanyl in there. You know, there's different theories. Are people mixing these drugs and just using the same containers? Are they purposely putting fentanyl and methamphetamine to make it more addictive? Probably all the above. But fentanyl is being found in cocaine, methamphetamine, heroin, pill form. So fentanyl is a very dangerous drug, but our biggest drug problem right now is methamphetamine. Years ago, we had the meth labs that started up. I think that kind of grew the population of users. And then, unfortunately, the drug cartels found a profit spot for themselves, started mass producing methamphetamine and bringing it up through the southern border. So now we don't see the labs, which is a good thing for law enforcement because they're very dangerous to deal with. But the only reason we don't see the labs is because a higher, pure, and cheaper form of the drug has flooded our streets. So that's obviously a problem. So I think a lot of the data points that Jim had were spot on. We see the same things. Obviously, he sees a particular part of the populace as we see the whole populace of St. Clair County. So some of the information may be a little bit different, but the numbers that Jim talked about were right on. Again, other than our female inmate population has grown over the years.
Thank you, Sheriff. Okay, Ken, you want to go next?
Yeah, and I would mimic and kind of confirm what they say with the stimulant use. We have a weird little trend, and I think it's still smaller numbers, but inhalants have become a new kind of issue. And even Dr. Moore earlier this month presented on some of the issues and dangers of inhalants, and that's your nitrous oxides. It's a weird thing that used to not be available, and now it's accessible in some of the stores. It's becoming easier to obtain, and again, it's one of those that appears to be harmless but isn't. So we've seen that. Another slightly more positive trend is we've seen in that harm reduction scene, naloxone is becoming much more available. In 2017, I believe, or no, not 2017, 2020, Odyssey House was able to obtain some funds and so far has placed 31 distribution boxes across the county. That was something that was difficult to do. We had obtained a vending machine previously that had to go back because we couldn't find a location for it where someone was willing to put that in their space. Right now, we have 31 of those boxes, one at every library branch, at all of the CMH locations, health department. It's accessible for inmates in the jail when they're discharging. So we've seen this expansion where in 2020 or before, our community would have maybe 100 to 200 kits be distributed in a year. In this last fiscal year, through Odyssey House, through those boxes, has given out over 3,600 kits into our county. So we've seen, that's 18 times more than what we were seeing before. And we're starting to see some of those overdose numbers decrease. We've seen some changes in the number of overdose deaths. So in that harm reduction scope, where we know people are going to continue to use drugs, no matter how hard we try to tell them not to, we're starting to see some of those effects of Narcan in our syringe service program, just helping reduce some of those other, I hate to call them side effects, but the other consequences of use.
Well, thank you for sharing that. I know that Liz, I think, has more to say on harm reduction trends and strategies, I guess.
Yeah, sure. Just a reminder, right? I always do this and educate everybody, but harm reduction is just a set of strategies to reduce, like Ken said, those harms that come from while you're on that period of time where you're using drugs. So that's a big focus for us here. And the naloxone, yes, is a win for our community. Definitely. Ken and other people, including the health department, but really a community has embraced that and uses it more as a first aid tool, like an AED or epinephrine or something like that. So reducing that stigma has been great, getting that out in the community. So I would just say great job to everybody for that. But also through our harm reduction program, the trends we're seeing out in the community is, first and foremost, people want to be serviced in the harm reduction program where they're at. They don't want to walk into our building, not a big surprise. But in the community, last year, we did 4,700 touch points or encounters with individuals out in the community. Here in the building, 142. But we still offer that. It's a lot less in the building, but we have it here on our normal business days and then out in the community as well. So I think there's just been a change for us in what we thought the program was going to look like to what it actually is going on. We have also seen a trend, just a little trend in users I shouldn't say that, away from injection drug use, more to smoking. And maybe that's what the sheriff's talking about, and Jim is just in the type of drugs that are being used. So we're seeing a little shift in that. We also have seen an increase in the request for things like fentanyl test strips, and we also have xylazine test strips as well. Xylazine being a non-opioid additive. I think that's out there that people are looking for, testing for. The issue with that is, of course, that Narcan cannot reverse the effects of that. So I think there's a big fear in our individuals who are using to have that. So they're looking for that. We have it available. We've been handing that out. Also, another trend for us and another learning point over, our program's about 4 or 5 years old. We are rebranding. So we're moving away from, it was called the exchange. And that just, that idea doesn't exactly give the impression of harm reduction, right? It just seems like we're in exchange for needles and syringes. And that is not all we do. That is a very small piece of what we do in our harm reduction program, where we're also testing for hepatitis C and HIV. We're giving out hygiene kits. We're giving out condom kits. Anything that is a secondary harm while you're doing your drugs. So we're rebranding and just calling it harm reduction. So you'll see that out in the community soon. Another trend I think we need to touch on is about the deaths and our overdose rates. I thought Ken would cover this. Being the last one to go is always difficult, and I thought I wouldn't have anything left, but he didn't touch on overdose rates for us. But I think we both have spoke about, probably all four of us, how we had a rapid decline in overdose rates in 2022 down to 40. And that was a big win for everybody. We were excited about that. But that sprung right back up again in 2023 with 61 overdose. Sadly, we weren't able to maintain that. That was the first year we actually were removed from a list in Michigan of the top 10 jurisdictions, for overdose rates. We got off the bad list for that. I'm not sure if we're back there yet. That's to be determined. But the deaths did come back up again. And I think it's important to look at the trends in our overdoses as well. We know that males are 3 times more likely to overdose and die than females. Something that kind of ties into what Jim was talking about race and disparities, is that we know that Black residents are 2 times more likely to overdose and die than our white residents. And then the age range is always our 25 to 44-year-olds have the highest overdose death rates as well.
Okay, that is a lot of good information on trends, not necessarily good information, I guess, but important information for people to hear about. So let's move on to the next question. And I think for this one, we'll start with our sheriff. It's a 3-parter, so listen up. And if you forget a part of it, I'll repeat it. How do you see the role of law enforcement, public health, and mental health services intersecting in the fight against substance use? And what challenges do you think we're facing as a community? And more specifically, what challenges is your organization facing related to this? I know that's a long question.
Yeah, no problem. I think, it's become apparent over the last decade or so that law enforcement in particular has to be more involved in, the role of recovery and being part of not just taking the call and arresting people and put them in jail, maybe the drug dealer or the, substance use disorder person who we have to be an outlet, right? So we come as law enforcement to all these calls of service, and it's our first point of contact. It's our first ability to have an impact on the people in the homes. And we've learned over the years that partnering with all the other people on the screen, and all the other services out there, we can be a positive part. We can start sharing data without giving information about individuals, and sharing services that are out there that these people that we encounter on calls would otherwise maybe not take the time to search out. Maybe they're in the bad way. Maybe they do have to go to jail because they committed a crime that they just have to go to jail for. We give them the information on the services, so perhaps, or maybe somebody else in the household that they're with. So perhaps they will reach out later, or somebody that they are with that was at the household can reach out on their behalf. And then again, the services in the jail. Our medical assistant treatment program is expanding. All of our programs are more widely available as people are becoming more accepting of the need to give programs to individuals who are suffering from disorders. And then, of course, after that comes the grants and the monies and the support. And we have worked better collectively as law enforcement with the other service provider, maybe the health department or the Odyssey House or BW Rock or CMH, and I'm missing a dozen service organizations. So I think we've done a better job of understanding our individual roles and understanding how we can expand those roles and work together. So for the first part, I think that's the best answer I can give. For the second part, the challenges, for law enforcement, our challenge is to be present and get those services out and provide, that lending hand and getting the officers and deputies to go, hey, listen, I know you've dealt with this individual before, maybe he's been violent before, but we still have to look at the end game and provide at least, a list of services that they could take, but also do our job as law enforcement, right? So I always start out my yearly PowerPoint I do for this recovery week, and I talk about law enforcement and how we're engaging and we're going to work on a solution. And then I end that sentence with, but our law enforcement are the only people that can enforce the law. So as our plate becomes more and more full, we still have to have that part of that plate for so long as there aren't to people who are.
Hey, Matt, I don't know, is that coming garbly to the rest of you guys when he's talking? Yes, shake your head, no, yes. Because I don't know if when you go back, the people out there are saying yes. So I don't know if you need to stay closer to your microphone, but you've been great most of the time, but for some reason it started sounding like you were underwater. So I don't know why that happens. No, it's doing it right now. Okay. Okay, wait.
Can you hear me now? Okay. So anyway, try to concentrate on
Oops. No, it's starting to do it again. And I'm not sure why. Is there anything? I am not a tech person. Sometimes there's another phone near you or anything. Does that matter? Does anybody have suggestions for Matt? Josh, you?
If anything, he might be able to adjust his settings for his mic with the little triangle.
They said that you might be able to adjust your settings, which is the little triangle next to the microphone on the bottom.
Did you try to hit it, smack it on the side, see if it comes back like an old TV?
I'll work on that and we can move on. I don't want to take everybody's time.
Let me move on to somebody else, Sheriff, and then we'll try to come back because it hasn't been doing it continuously. So let's just see. And somebody just said 99% of the time was fine, but just right now for some reason. So I don't know if you can get any of your tech people in there. Okay, so I'm gonna go to let's see. How about Liz? Liz, I can't hear you.
Can you hear me now?
I sure can.
All right. Well, I would agree with everything Matt just said, right? We work better as a team together. How do we intersect? And everybody already touched on that. All of us that you see here on this screen and many others in the community are on all kinds of groups, subgroups, talking about how opioid funds are being spent. how we can work together, learning about everybody else's organization, and just simply knowing that person and that we can pick up and call that individual is huge, right? What we say about St. Clair County, and the truth is, we're at a size where we can get some funding in, which is great, but we also are small enough to know our neighbors and be friends with people and see them at almost every event we go to. So that's wonderful. And it's good for the people of the community that we can easily access help. So that's most important for us on how we intersect. But I think challenges, a huge challenge here at the health department is stigma, right? Stigma in the community, stigma with maybe some people who are decision makers or stakeholders even. And that transpires into when we're trying to message, communicate, be out in the community, we can get a lot of static from individuals who don't support the mission or who don't understand what we're doing. So a lot of times ours is how to communicate that so that it reaches everybody. We spend a lot of time trying to figure out how best to communicate harm reduction services so that individuals can understand, and that's any individual in our community, and how to reach them. So I feel like stigma, perception are challenges for us, and also staying ahead of the game. We do have to stay connected with everybody here to understand what drugs are being used, what's new, how will that affect somebody's health and well-being, right? As we talk about trends switching from injection drug use, I know that's still going on, it's not really switching, but those harms are about hepatitis C and HIV and soft tissue infections. When you start talking about people smoking, doing drugs that way, you're talking about dental, oral health, respiratory wise. So you have to switch your whole game around as far as health, wellness, and what you're looking for and what you're measuring.
I agree with all that, and I'm happy that you brought up about stigma, because I do remember a long, long time ago when I first heard about the needle, when I very first heard about needle exchange, I thought, what? Why are we going to help people do that? But then somebody, it was actually Dr. Mercantile that explained it. Something I was at about, because we're all different. Some people might use a drug for 5 days, they become addicted. Another person uses it for 10 or 20, and they won't become addicted. And we also all know that a lot of addiction started with prescription pain medication. So some people, I think, have it in their head that the people who we're talking about are, I don't know, like homeless, people who've never worked, like people who, somehow are not the same as them, they think, but we know that that's not true. And I think that it's really important that people do understand why we, if somebody's overdosing, we want to use naloxone, why we want to do the needle exchange or any of the other things, because people don't, people don't choose to have an addiction. They don't like go into it and say, let's see if I can get addicted to heroin or, or any of the other things that people use. And so I think it is really important that people understand the difference, that we're all made of different. So I'm lucky. I don't have an addiction. Another person, not so lucky. Both parents are maybe alcoholics, and they end up being one themselves. So they have, genetics, and there's so many different things that make it up. And I don't know if you want to speak any more to that, because you're a nurse, so people might believe you more.
Yeah, no, exactly what you said. But people with social media, with our Facebook pages, people are very quick to respond back. We're a little bit more liberal with what we say when we're on a keyboard and not talking to Liz King face to face, right?
Exactly.
Things come through, but it's also important for us to listen and say, okay, in my circle, we don't think that way, right? But
Right.
There are individuals in the community who still don't understand what we're doing with harm reduction. So we have to remember that and communicate and market to everyone. So we're working really hard at that.
I think too, any opportunity like today, any opportunity we have to be able to make sure that people hear all of that information is important. And hopefully eventually the world will be a little bit better place in terms of understanding, because that's what people need in terms of supporting people with substance use disorders, to help people get into recovery, etc. So anyways, okay, let's move on to Ken.
And I wanted to touch even on that harm reduction and the stigma surrounding it. As a person who's in long-term recovery, as a former IV drug user, and as a clinician, it was one of those that I had to develop an understanding of. It was one of those that I didn't know how I felt initially, and it took a little bit more education, information, and looking at that this is something that's necessary, that this is something that has a mission. And honestly, in St. Clair County, it nails its mission. Some of the consequences are hepatitis C. We've cut our rates by like almost a third or a quarter from where we were. And that's going from 160 new hepatitis C cases down to maybe 30. That's 130 people who don't have a chronic long-term illness that leads to other issues. And then it was recognizing this other part is that it's a pathway to recovery. And the way that someone finds recovery can be very different. I go in, if I'm in making that touch point, that contact with a compassionate nurse, a peer recovery coach, someone who's been there, and it's the day that I really didn't want to use drugs, but here I am going through the motions. If I hit that right person that says, hey, I've got an alternative, I'm more willing to accept it. I think the rates are people who use those syringe service programs are 5 times more likely to enter treatment than someone that doesn't. And it took some of these facts and this evidence that said, okay, I'm on board. This is something we need. It's a little bit different. And, we're a lucky community to have it. Some of our communities in the state, they don't exist. They leave the syringe service program and there's the sheriff or a local PD that's waiting. Staff members that work at some of the others in our state are being arrested because they're doing their job with the syringe service program. So it's, we're a little bit more progressive in our openness. We're not all the way there. That other part is the pathway to recovery. That's Sheriff King. The gentleman in brown will remove someone's door and help them find recovery. Here's a quick place where you can sit and rest for a little bit. And while you're in here, we've got some services and some people to talk to. So it's that part, the mental health provider. We go in because we're depressed. Turns out my depression is also part of my alcoholism. Turns out that might also be part of my prescription pill problem. So it's this method of finding recovery, and it might be through CMH. It might be through the health department for, a WIC appointment. It might be through Sheriff King or one of our courtrooms. So recognizing that there's a lot of different ways to come in. And if Sheriff King's folks and Liz's folks and the CMH folks know who to reach out to or who to connect to, that community communication, that part, it works. If his deputies don't know what to do, they feel helpless. If the health department doesn't know where to refer, they feel helpless and it doesn't change. So, there's a lot of work that we can do together and understanding that we each play a different part, in that path to recovery. We had on here kind of some of those challenges. Some of the challenges we face is there's staffing shortages. Not everyone wants to be a drug and alcohol counselor. Not everyone wants to be a social worker. It takes a master's degree. 6 years of college doesn't sound great to everybody. And then you come out and work in the public sector. So we have this staffing issue and some current concerns with just making sure we have enough people to treat the community. And what we see is we can build all the programs, we can create the newest, but if we don't have, the right people to staff them, we might as well not have it. So staffing becomes kind of that issue. And then again, that huge part was stigma, that we have, a lack of understanding that people are struggling, and, shame, guilt, those things aren't what helps someone move through recovery. That's usually what keeps them in addiction. So.
Hey, Jim, I don't think you responded to this question. Then I'm gonna try to go back to the sheriff if he has more to say. Go ahead, Jim.
First, I agree with everything folks have been saying. Even the sheriff's underwater speech was making sense to me. I think for us, some of the big challenges, the way I see them, has to do with the silos that exist. And I think we've done a lot of work to break down silos and how we practice, but the funding silos are still there. And funding is not ever as flexible as it needs to be at the community level to really help people the way we should. We have one of the big challenges that the folks that we see don't fit neatly it's rare to see somebody who fits neatly into one system. They have needs that cross a lot of systems. And the big challenge is, how do you provide access to all the types of supports a person should have at their disposal, while they generally reside in one of the systems. So, I mean, that to me is one of the bigger challenges. And I'll let you go back to the sheriff.
Okay, Sheriff, let's try it again.
How's it sound now?
Perfect.
Okay. I didn't do much, but okay. No, I think everything got covered out. I'll pass the buck back to you so we can move on.
Okay, we'll go on to another question. I do just want to say too, like most of you did address the issue that we do work well together as a community, where Liz was talking about, we're big enough to, get some funding and other things, but we're also small enough to know our neighbors. And I remember, and I'm sure that you all remember when along when I'm not sure if he was there was Ken, but actually it was Tom Seppo who called people to come together at Operation Transformation. It was pre-COVID, to say, hey, we need to all get on the same page with this opioid crisis that we got going on. Remember that, Matt? And I mean, Tim was probably the Sheriff Donald was probably in at the time, but we all went there, and then out of that came the Executive Opioid Oversight Committee, of which law enforcement sat on, hospitals, Region 10. Providers, health department, everybody who we thought was a key stakeholder. And then eventually that became attached to the community service coordinating body, which we've talked about, has really been a great thing in our community, because I think we do work collaboratively, because we're for the most part, we're always all looking out for the best interests of our community, and people do step in when it doesn't seem like a logical spot for law enforcement to be, or mental health to be, or health department, or whoever. We come together and talk about things. So that, I think that has been definitely a benefit for all of us. And so moving forward, we have 18 minutes left. We did talk about some of the significant gaps that we make, but what do you think needs to be prioritized? I mean, that's where if nobody brought up, which I knew you would, talk about stigma. I think that that's still one of our big areas that we need to continue to educate people, because you heard Ken say it and I said it when I very first heard about some of the harm reduction strategies. I was like, wait a minute, what? But we became more educated about it and understand the value in doing those things. But a lot of people don't take the time to learn that. And so I think that's going to be a job. And I don't know, Liz, would you like to go first on that?
Sure. So one of the big priorities that we see here at the health department is specifically around women. We've talked about women a little bit, and how drug use maybe, or crimes because of drug use, growing in our female population here in St. Clair County. But as you all know, pregnant women of childbearing age are as a primary focus for us at the health department. We have a maternal infant health program, which is a home visiting program for pregnant women. You enter into that program by income level. So you have to have Medicaid to enter in, but a lot of times people have substance use identified as an issue, or they live in a home with a substance user. And how this kind of all ties together is, if you are aware, in St. Clair County, we lost a very large OBGYN provider in the last year, which displaced many women's care. And they were our primary referral source for our pregnant women who did not have a provider. Now there is only one provider locally, and they're doing a great job, and they're seeing a lot of women. But the bulk of women who are enrolling in our program, so we do hundreds of women a year enroll. So those who do not have a provider when they come in, 80% of them now are being seen in Macomb County and delivering in Macomb County outside of St. Clair County. And there's also 6% of those who just said, I'm not going to have prenatal care. I guess I'll just show up at the ER when I'm ready to deliver. And that's a problem. And how is that a problem with our substance using community? Is you don't have that touch point that Ken was talking about. When women are pregnant, you have the opportunity at that time, possibly they want to make a change. And if you can't identify that there was an issue and get them into this care treatment that we have here in our community, you're going to lose them. And it's great that Macomb County is helping out, but they don't know what's going on here in St. Clair County. They cannot connect our women who need supports with us as easily as we could locally. So that's a huge gap And then what I also want to point out is you bring in the problem of pregnancy associated mortality. And that's a measurement we look at here at the health department and statewide. We live in a region of Michigan that has the second highest pregnancy associated mortality in women. And the highest is not south of us in the big counties. It is north of us, up the east coast of Michigan. And that's more your rural community, right? And we're heading that way. Our numbers will end up worse if we don't reverse this problem that's happening. And with the pregnancy associated mortality, let me explain that. That means a death while you're pregnant or a death up to 1 year postpartum. And 30% of those deaths are because of substance use disorder. And most of them happen 43 days postpartum. And I'm sure like Ken can talk about why that is. Most likely is because women get back into using at that time, or use the same amount they did before, or they're using a different drug. But we miss that opportunity to get them into treatment, to get them into recovery, to get them into supports when we don't have a local provider. So this is really a big gap for us here at the health department and as a community.
Okay, that definitely is a big gap, and I know that OBGYN provider shortage is not good, and hopefully somebody's on the line to get in this area in the near future.
That'd be awesome.
Yeah, hopefully. Okay, so let's see, who wants to go next? Ken, would you like to?
Sure. What I see as some of our gaps is our higher level treatment. We did a presentation with a research collaborative earlier this month on the Recovery Summit that kind of showed we have lots of outpatient care, but we don't have withdrawal management nearby. If you needed to go and enter treatment into detox, which Jim mentioned earlier, that's a third of our people. That's where they start. The closest one being Sacred Heart, the next closest being in Pontiac. And that's not nearby. So the ability to just enter into treatment or get started with a detox facility would benefit. And then again, those step downs from detox generally becomes an inpatient residential. We lack one of those in our community. And then also some of the other ones that are your behavioral health, urgent care, or crisis stabilization. I'm having a bad day. I need to step in. I need a place that's safe for me to spend maybe the night, or I need to come down. And then tomorrow I can make a more educated decision about what I need. I don't need detox. I'm not at risk of that, but I need a place to go. The emergency department is the default, and they're not equipped to handle a person in those situations, or that's not a long enough stay there. So some of those higher level services where I need help right now, and if I can, honestly, if I could get there by bicycle or foot, that's wonderful. If I have to find a ride and organize it and it's 30, 45 minutes, I need gas money. It just becomes this barrier, same as what Liz is kind of saying. If I need prenatal care and I have to go 45 minutes to get it, and then when I deliver, I have to, it becomes these barriers that we don't have some of these higher levels of care here in our community. So I would identify that as a significant gap that we have.
Okay, and oh wait, yeah, I'm unmuted. Make sure it's unmuted. Well, I don't know if you know, but we are looking to develop a behavioral health urgent care center, and then maybe down the road a crisis stabilization unit. And so hopefully those things can happen in the very near future. For sure, the first has to happen before 10/1/25 because it's a requirement for us. Okay, next, let's go to let's see, Jim. Do you want to go next?
Sure. I agree. Ken is, hit the nail on the head with the gaps that we see are the need for local access to the more intensive SUD treatments. There is no residential facility in St. Clair County. There is no detox facility that sits in St. Clair County. There's no methadone provided. So if you are someone, there are different drugs available to help in, medication assisted recovery. For some people, methadone is the best choice. The problem is you have to start out with daily dosing. And so if you live in St. Clair County and that's the best support we can provide you to help get you, off heroin, you're going to have to go every day to Waterford or every day to Flint or every day to, somewhere in Macomb County. So it's a big barrier. And it's not just a barrier transportation wise, there's also a stigma barrier, a different kind of stigma. Some people here where they have to go and they say, there's no way I'm going to Flint. There's no way I'm going to Waterford. I'm not going to a community like that. So, you know, there are different, it presents different types of barriers for different people. And just to kind of highlight, you know, how the need. Last year, we spent about $4.8 million on SUD treatment for residents of St. Clair County. That's just the Region 10 PHP spent $4.8 million. Of that $4.8 million, we spent approximately $3.5 million of it out of county. So, you know, almost 75% of our spend for St. Clair County residents goes to out of county providers. And it's based on, you know, it's almost all those intensive services. So not only is it a barrier and a hardship for folks that we're serving, you know, that's $3.5 million that we could be using to help support our economy as well. You know, if we had providers here, if we were bringing more staff here and making wages, that's $3.5 million we're spending somewhere else to meet the needs of people who live in St. Clair County. So we see that as our biggest gaps.
Yep, those all continue to be big issues. Okay, I think Sheriff King, you're the only one that didn't talk yet, right, on this topic?
Correct.
Okay, your
And
turn.
hopefully- No. So I think I agree with Ken and everybody else. We need more in-placement treatment, not just for substance use disorder, which is obviously what we're talking about, but I think there's a big problem with mental health in-placement treatment, and there's none here in St. Clair County, at least none that we can find beds where people can go to. And those individuals oftentimes self-medicate back to whatever drug of choice or start self-medicating because they're introduced to other ways to make themselves feel better. And quite frankly, oftentimes end up in my jail, which is a problem for them because it's not the place for them. And it's a problem for my staff. So I think all around in placement, overnight treatment for substance use disorders and for mental health disorders. It's the biggest problem right now. I think in the criminal justice world, when you talk about mental health and the lack of place to take people who need to be treated for mental health, not locked up. And that bleeds over to substance use disorders.
Yes, and unfortunately, I think that's going to become even more of an issue because we're having issues with all the inpatient, psychiatric inpatient wanting ridiculous increases in their rates and things like that. And so we're doing the best we can negotiating with them, but it's not really good. They're trying to hold us hostage, I guess, on those issues. But you're right. When it comes down to it, we need the places for them because jail is not the right place. We definitely could use, as several of you mentioned, residential detox and some other programs here right in St. Clair County, which we don't have. And I thought Region 10, if you said that, Jim, you were trying to do something related to that. But we are down to 7 minutes, and I don't know, we can each have, the last question was supposed to be if you want to take a minute to highlight some of the positive things, maybe one or two or the most positive thing that you think your organization has done over the last several years to address the growing substance use crisis in our community. We could each do one thing and then have a couple minutes for a couple questions if there are any, but that might actually take us right till 2 o'clock. So who would like to go first on that? Jim, okay, go.
Rather than highlight what we've done though, as a funder, I just want to highlight something that's coming up. And that is that we are going to, in this fiscal year, receive $1 million in opioid settlement funds for use in Region 10. It'll be a little more flexible than a lot of the monies that we do receive. There will be some strings attached to it, obviously, but we are going to get $1 million of extra funding to cover our 4-county region out of that opioid settlement money.
So that is great. Is that in addition to what St. Clair County is receiving, or is that a part of that?
That is completely separate. It's each of the 10 PHPs will receive $1 million this fiscal year.
Oh, that's great. And I know Ken sits on the group where they're looking at how the county dollars are going to be spent because they're getting some dollars as well. Okay, who wants to go next? Ken? Maybe that's a nice segue to you.
Sure, and it is that, they're one of the nice things is funding might not be as big of a barrier as it has been, with the county getting 13.5 million in settlement. The other one that I wanted to touch on, and this was just a couple weeks ago, Deb, I believe you might have attended. I know Sheriff King was there because I watched him pass me. Is we had the Recovery Fest. We're seeing some engagement. It's a stigma reduction. It's support. Over 40 vendors, 5 or 6 different multiple partner agencies. 120 people in that softball tournament, and scores of volunteers, and then an estimate of over 1,000 people attending. And that is a recovery focused, drug and alcohol free, community based event. And to see families and community members and that come together is, and that was something that's been going on for probably 6 or 7 years and was smaller. And to see it really truly expand and be accepted, right in the heart of downtown at the Port Pine Grove Park was really great to bear witness to.
It was great. I was there in the beginning of it, and I helped kick it off with Patrick Patterson, who all of us know is the director of Blue Water Recovery Outreach Center. And it has grown from it was just a couple of teams playing base. It was actually, I think, initially law enforcement against folks in recovery. And then each year it's gotten bigger and bigger. And it was great to see the number of people there. There were, I think he told me 43 or 46 vendors, like you said. And there were kids, adults, everything. And it's an alcohol-free fun event, rock climbing. There were great things going on there. So I think that, those things do help, to help to reduce stigma. So, okay, let's see. Liz, would you like to go?
Sure. I think it's difficult to nail down one thing though. That's hard to do.
You got a few minutes. You can go a couple.
No, it's okay. I think we need to look back at what brought us into this game, at least as a health department. And those are things like hepatitis C. Those numbers have decreased rapidly. We were at 265 cases in 2017. Just for that year, we're down to 30 last year. Neonatal abstinence syndrome. At the peak of everything, we had 11 infants per 1,000 births being born addicted, and we've cut that in half. Then also, I think as a community, it's important to celebrate that we reduce the amount of opioid prescription units in the county going out too, and that was really tackled as a group. So those are good things to celebrate.
Agree. Okay, who did I miss? Sheriff King?
Yes. I think Ken really hit the nail on the head. I think the amount of activities going on in the recovery community that highlight the battle against the stigma. I know that we are more and more becoming involved in these things. I went to a couple of picnics over the summer and talked to people who are in recovery, and they talked about the fact that they have places to go and social events to fill their time with now. And being bored and going through recovery is not a good thing. So I think people are standing up against the stigma. And I think on the law enforcement end, I'll try to wrap it up quick so there's time. The fact that on the law enforcement end, we're able to start admitting out loud that we need to be a bigger part of the solution while still balancing our responsibilities in enforcing laws and arresting the people that need to be arrested, and then offering services afterwards and being part of the healing process after. So I'll leave it at that because I know we're short on time.
Okay, we do
I did want to piggyback that one though, because what we do have as a county is we've enrolled and enacted a large number of jail diversion, where people are meeting Sheriff King, but we're not housing them there. We've got our recovery court, our juvenile probation expansions, our MDOC probation parole has its own peer recovery coaches that started for the state here in St. Clair County, and then the new alternative contempt track, and then even the family preservation program that we are doing at PCC to help keep families together. So there's a lot of these things that our county is bringing in to, again, keep them out of jail or, serve these clients. So
I'll just add one last thing too, that I know that actually upcoming, I have a meeting with Patrick Patterson for us to talk about what we can do continually work more collaboratively together. And one of the things that I think is something for in our county, most of the stuff we've talked about is concentrated in Port Huron. And we need to look at the outlying areas because the problem exists in K-Pac, Marine City, St. Clair, Marysville, everywhere else as well. And so we're going to look at doing some more things through maybe people using our offices as satellite locations for whether it's, recovery groups or different things like that. And so hopefully more will come of that. But I do think that we've made a lot of strides, and we will continue to do that. And at this time, it is 2:00. I want to thank all of you for being here. I'm sorry we don't have time for questions, but if people have them, you can put them in the chat, and we will put the answers in the email that gets sent back out to all of the participants. So thank you all, and have a great weekend.